All right, some big stories coming in from the national capital where there's a huge surge in cases. In many senses, Delhi is the epicenter of COVID in the country among the big cities. Arvind Kejriwal now reaching out to the media fraternity saying journalists are reporting from the most adverse situations. They should be treated as frontline workers and they should be vaccinated on a priority basis. The Delhi government is writing to the centre in this regard. Sukriti Dwivedi joins us now for more on this. Sukriti, this is one decision. There's also an important decision on the production of remdesivir. That's an important drug. What are you hearing on both of these?
Well, as far as the point on Mr. Kejriwal writing to the Prime Minister is concerned, definitely a move to appreciate, and especially coming from us as journalists, definitely a helpful move for our fraternity. But of course, if you see it from a very logical perspective, we have to look at the facts also, and the facts remain that there are several state governments across the country that have already been vaccinating journalists without writing to the Prime Minister in this regard, considering state governments do have a certain window of opportunity in that sense that if there are certain categories, certain professions to which they want to allow vaccinations, then they have allowed that. For example, that has happened in Uttarakhand already. In Ludhiana, it has happened in other parts. Then in Chennai, journalists have already been vaccinated. So none of these state chief ministers had to write to the Prime Minister in this regard. They've already done that. So that is something that could be pointed out in Mr. Kejriwal's case as well, that if he is keen, if he finds that the demand coming from journalists is valid, then why does he not allow vaccination already like other state chief ministers have? Why is he writing to the Prime Minister in this regard? So that's as far as that first point is concerned. As far as the remdesivir production news is concerned, the government yesterday said that there is no shortage of remdesivir. It was being used in an inappropriate manner. It was being prescribed to home isolation patients when it's supposed to be only for hospitalized patients who are on oxygen. Healthcare professionals have to be more careful while prescribing remdesivir, but there is no shortage in the country. And and less than 24 hours after that press conference where they made these statements, they are now ramping up the production capacity by a huge margin. There are 7 manufacturers in the country already. 6 manufacturers more are being added. Many of these are capable of producing at least 10 lakh vials of remdesivir per month. So definitely a strategy from the government that initially they try to run away from this term called shortage, just like they ran away from it in the case of vaccine capacity. They said there is no shortage, and then vaccine approval rules were changed to allow more foreign vaccines into the country. And similarly with remdesivir also, they said there is no shortage. But right after that, they are ramping up the capacity.
All right. Thanks very much, Sukriti, for joining us with those details.